Welcome back to Living 808. If you struggle with severe obesity, surgical weight loss may be for you. Here with more information on that topic, Dr. Stephen Fowler with Castle Medical Center and Suzanne Asaro, who is the Director of Bariatric Services at Castle Medical Center. Hello, welcome to Living 808.
Hi.
Doctor, why don't we start with you? What types of surgeries do you offer and who should consider the surgery?
Well, we are the only program in the state that offers a full line of bariatric surgical operations for these types of patients. And this ranges from the gastric bypass, the vertical sleeve gastrectomy, and now the duodenal switch and the lap band. These are all very different operations, and each one has its own expectations in terms of what a patient would expect for weight loss and also improvement in their health.
Okay, so that's good to know, because I've heard of gastric bypass before, but I didn't realize there are other surgeries available. Okay.
So the gastric bypass is kind of like that well-proven one that's been around a long time. A lot of our families and friends have possibly undergone this procedure. That's still here to stay. It's kind of the gold standard. People have significant weight loss and improvement in their health, but there's some newer ones that are out there too, something called the vertical sleeve gastrectomy, which is just cutting part of the stomach only, and people see substantial weight loss in addition to metabolic improvement with that. And there's even something called that duodenal switch I mentioned on, which is a little bit fancier, which creates greater metabolic health changes.
Okay, and who is a candidate for these surgeries, or who would be the best kind of candidate?
Sure. You know, typically it is meant for somebody who has a significant weight condition. So these are big operations. So we're talking about people who are probably at least 100 pounds overweight, or if their BMI calculation comes about 35 and greater. And in addition, it's ideal candidates would be people who have significant metabolic disease, so that would be advanced diabetes, advanced heart disease. Those people will see significant improvements with these operations.
Suzanne, how does one choose where to get the surgery done?
That's a great question, because we really want our patients to be well educated and do their research. You really want to look for a very comprehensive and a nationally accredited program. Castle has national accreditation, which really substantiates and validates our commitment to high quality and best practices and outcomes. You want a fully comprehensive program that is going to support you throughout your journey, both before and after surgery. We have nurses, dietitians, psychologists, fitness experts, really to help the patients go through and have long-term success. And you want to feel comfortable with the surgeon. Dr. Fowler's been with our program for over 10 years, has done thousands of these surgeries, and this is the sole focus of his practice. So you really want to have somebody with that experience who's going to help guide you and who you can talk to. Go to an informational session. Dr. Fowler leads all of our information sessions, and he's there to answer your questions even before surgery, as you're just trying to think about, is this right for me?
That's great. I mean, it sounds like in addition to Dr. Fowler, you have a team there, because like you said, it is a journey. It's not you get the surgery done and then bye-bye, you know, never see you again.
Absolutely.
Right?
I mean, that really speaks to, you're going to lose a lot of weight with that operation, but it's how that patient develops fundamental lifestyle changes. Are they going to see that weight stay off years 2, 3, 4, 5?
Right. And this is a life-changing surgery. How much weight can someone expect to lose from it?
You know, there's significant changes. I would say on average about 100-pound weight loss we would see with our patients. Sometimes we'll measure it based on percentage of excess weight loss. But I would say that our focus is not necessarily, you know, how many pounds can that patient lose, but it's what kind of improvement in the patient's health are we achieving. And so parameters we'll look at will be diabetes remission, getting off of their medications, getting off of their obstructive sleep apnea machine at night. Those are the types of parameters we use as a metric for success.
Sure. We are almost out of time, but for people who want more information or want to get started on this, what's the best way? What should they do?
Well, we do have an app. You can search for Castle Bariatrics on any app store, and they'll give you a lot of information. Or call us directly at 263-5176 or castlemed.org, and we'd be happy to answer any questions.
Okay, great. And we'll go ahead and put that information on our website as well. Thank you both so much.
Thank you.
Thank you.